In this talk, we consider the question, what should I do in 2024 regarding 1 versus 2 stage revision for prosthetic joint infection? My disclosures are regularly updated on the AOS website. We will discuss an overview of revision for shoulder prosthetic joint infection, arguments for single-stage treatment, when to consider 2-stage treatment, some technical tips, and antimicrobial considerations. Diagnostic considerations have been addressed previously, so for the purpose of this talk, consider that we are treating the patient surgically for known or presumed prosthetic joint infection. However, with the diagnosis often having a degree of uncertainty, the key point of surgical decision-making is what to do with well-fixed implants, since retaining these risks and reinfection while exchanging them increases morbidity. This represents complex surgical decision-making that should be done carefully on a case-by-case basis. The indication for 1 versus 2 stage revision has been looked at in the literature. In about half of studies, a standard treatment protocol determined the manner of treatment, and the remaining studies a variety of other factors was used. Overall, the literature has been trending towards superiority of single-stage revision since this has equivalent or slightly superior recurrence with lower morbidity and complications. It should be noted, however, that this is a very difficult topic to study because of the low prevalence of shoulder PJI and a selection bias in the literature toward 2-stage treatment as the historical gold standard and for higher risk cases. One way that we can evaluate the efficacy of single-stage treatment and whether it is broadly applicable is to look at the results in centers where single-stage treatment is used in non-selective patients, in other words, exclusively. The following 2 case series demonstrate the results of this philosophy. First, in this series of 40 patients over a 15-year time span, exclusive single-stage revision resulted in a 90% eradication rate. In all cases, shoulder PJI was chronic.